said, I want to introduce our keynote speaker. Introduce our keynote speaker, Dr. Burt Berkson, from my heart to yours. And truly, I have had Dr. Berkson come to other conferences. He has been so kind to come across the country and speak. And Dr. Berkson, to me, is the angel of hope and giving us truly concrete examples through his patients where low-dose naltrexone and alpha-lipoic acid have people alive and well who, by all terminology and prognosis, should have been passed on long ago. And with this, I feel that we have the best speaker, the best opportunity. Our speakers list is shorter this year, but it's always quality and not quantity. And Dr. Berkson, I put you on for 2 hours because I wanted you to have all the time to say everything you want to say and need to say to this audience, and for them to be able to ask you the questions and receive the answers that they came here for. Please join me in welcoming Dr. Burt Berkson.
Thank you. It's a pleasure to be here. Today, I'll be speaking about low-dose naltrexone, protocols for autoimmune disease and cancer. I have a medical degree, a master's degree, and a PhD in microbiology. Never thought I'd ever practice medicine. I thought I'd always continue as a professor. But years ago, by the way, this is where I'm from, Las Cruces, New Mexico. It's very pretty there. Years ago, when I was a medical internal medicine resident in Cleveland, Ohio, at one of the university hospitals, I was asked to take care of some people with terminal liver disease. And I was told that these people would die, nothing could be done. And my task was to watch them die and take notes, present it to grand medical rounds. As a medical doctor, you're supposed to follow the orders of the chief. But PhDs are always looking for new things, and I had been a professor for several years at Rutgers University and the State University of Illinois. And a PhD is always looking for new things. So I called the National Institutes of Health and spoke to the head of endocrinology at that time and kidney disease and diabetes. And there was Fred Barter, Dr. Fred Barter. And I asked him, I had known him because I had had a grant through NIH years before, and I asked him if he knew of anything that would regenerate a liver. And he told me that he thought alpha-lipoic acid would be the miracle drug for the reversal of complications of diabetes. And he was studying it for diabetes, but he said when he gave it to people with diabetes, they seemed to not only regenerate their blood vessels and nerves in their feet and their eyes and other parts of their body, but their livers seemed to get better. So he sent me the lipoic acid. I ran down to an airport, picked it up from a commercial pilot, ran back to the hospital, injected it into these two people, and within 2 weeks they regenerated their livers. And Dr. Barter was very happy. I was all excited. The chiefs were angry at me. They said, I was told that you can't do these things in a hospital unless you get previous permission to do it. And I was very naive medically. I just thought you do the best thing for your patients. And they had told the families the patients would die, and they were alive and well. Incidentally, that was 32 years ago, and they're still alive and well without any liver disease. Told by one of the chiefs that, do you want to make us look like fools? Well, years ago, I wrote a book, which is still my favorite book that I wrote. It was one of my books. It's called The Alpha-Lipoic Acid Breakthrough. And in the foreword, Dr. Julian Whitaker from Newport Beach wrote that many doctors he knows would rather have their patients die than try something different. Well, this is Dr. Barter and I and Barry Rumack when we were invited to Germany to be visiting scientists at the Max Planck Institute in 1978. This was after we published a paper on the reversal of 75 of 79 people who were actually waiting for liver transplants with just intravenous alpha-lipoic acid. That was over 30 years ago. I was appointed the FDA principal investigator for this as a drug. Cheap, very effective. Nobody is interested, or very few people are interested 30 years later. One of the worst damaging agents to the liver are Amanita mushrooms. And one of the reasons I knew about this was because my PhD is in an area of microbiology called mycology, and I was an expert on mushroom poisoning, and I'm still the consultant to the CDC on lipoic acid and liver toxic mushroom poisoning. This was our original paper that we published, thioctic acid, which is another name for alpha-lipoic acid, in the treatment of poisoning by this horrible, horrible toxin, alpha-amanitin. Barter, Berkson, etc., from National Institutes of Health. Then in 1999, I was invited by the Internal Medicine Society of Germany to talk about my treatment of hepatitis C with alpha-lipoic acid. And in that article that was published in 1999 in the German Journal of Internal Medicine, Medizinische Klinik, I wrote, "It appears reasonable that prior to liver transplant surgery evaluation or during the transplant evaluation process, that the triple antioxidant treatment protocol should be considered. That's lipoic acid, selenium, and silymarin. If there is a significant betterment in the patient's condition, liver transplant surgery may be avoided." Well, this triple antioxidant process that I developed, this protocol, is actually very, very inexpensive. And I believe that liver transplants cost about close to $500,000 the first year. The patients I regularly see, I see many adult onset diabetes patients with neuropathies. Alpha-lipoic acid, especially intravenously, reverses this in many cases. I see many hepatitis C patients. Probably the majority of people I see are hepatitis C. They've been through the regular treatment with no good result. In fact, many of them develop heart disease, severe anemia, and liver damage from the normal treatment. Alpha-lipoic acid often helps these people live normal lives, and lipoic acid can actually, in my opinion, stimulate stem cells in the liver to regenerate normally. Many of the patients I see are autoimmune people, and I use low-dose naltrexone plus alpha-lipoic acid and other things too. And I see some cancer patients.